No one wants to think about what happens when we get sick. And even worse, what happens with the healing process? We hear these horror stories, but we don't want to consider that we will ever be in that position. Reality is, your health insurance policy that you think will cover you will not. So unless you have a lot of money in the bank, you're going to be forced into whatever the government has money for in the facility that they have earmarked for you. So if you are in a position that you feel like you'd rather recover at home, you need to learn about home healthcare policies, what they do, what they don't do. They're surprisingly more affordable than you think. And I'm going to introduce you today to a company called Mutual Protect, who's come up with a great product that takes on pre-existing conditions. So stay tuned for this episode because we're going to talk about something that's not exciting, but important. So when you're recovering, would you rather recover at home or in a skilled nursing facility? I don't know about you, but I'd much rather recover at home. Likely you've never considered the out-of-pocket costs of what you're going to incur to make that happen. Today we're going to have a conversation with Jim Waterworth from Mutual Protect, district manager. They've created a very unique product that I have yet to run across in the market that I think a lot of people would be very happy to find out about. Thank you for being on, Jim. And I look forward to hearing today and having you explain again in layman's terms of how this product that your company's put together is affecting people out there in society. So let's talk about home healthcare.
Okay.
All right.
Yeah, so our home healthcare policy provides $180,000 in home healthcare. So the various nursing that goes with that. And it allows our clients to get their care at home as far as having to go to an assisted living facility. So that's a huge appeal to our clients when it comes to
And are we
that.
talking only for older demographic? Or?
No, it could be someone younger that has a injury and they have to stay home and get their nursing. They have that option of doing that. So it's really for anybody because diseases happen to everybody at different ages. So but generally it's our biggest clientele would be someone that's over 60.
Makes sense.
Yeah. And they put it on top of their Medicare.
Because Medicare doesn't cover any home health care benefits?
Not too much, no.
Not too much.
No.
So that means, it's one thing I've never really understood, how people end up in the short-term, what are they called? The rehab centers?
Right.
Okay. So this is to help offset that. So you go to the rehab center. Is there coverage there for rehab centers?
All of our coverage is for care that's done in the house.
But I'm saying within their Medicare plans, is there coverage for rehab centers? Some people go into a rehab center. I've always wondered this about on their health insurance, their Medicare plans. So if somebody has to go into a rehab center, who's paying that bill?
I think Medicare.
Medicare covers a rehab center, but they're not covering it if you're in your home.
They cover 20 days of in-home health care every quarter, every 90 days. Yeah.
So if you require more than that, you better be able to foot the bill.
Right.
And if you can't foot the bill, then you're going into an in-care, in-home,
right,
in-facility,
right,
environment that nobody likes.
Right.
You walk in, you got that nice smell that we all know so well. You can't imagine being stuck in that bed, right?
Yeah.
And I just feel so bad walking in there. Whoever you go to a visit, you're like, oh my gosh, hope you get out of here soon.
Yeah.
Right? They're miserable. So if you want to avoid that trap, you put in a policy like what you're telling me about here.
Yeah.
Okay, can you tell me a little bit? So this is how old can you be to buy these policies?
From any age up to 85.
Up to 85.
Right.
Wow.
You can use it after 85 as long as you have the policy before you turn 86.
So you have to buy it before 85. As long as
you're 85 before you turn 86. Yeah. You can be 85 years old in 6 months, you can buy it.
Oh, I see.
Yeah.
Up to 85 in 6 months. That's why I was confused about that.
Yeah.
Got it. So again, one of the unique things when you first introduced me to this product that I was so impressed with is that, again, you typically, or most insurance products don't take on anything pertaining to a pre-existing condition situation. Your product will, with limitations, right? With stipulations, I should say. Can you tell me a little bit about what you mean by that?
Yeah, so as far as underwriting on that product, we don't take anybody that's currently in a home healthcare situation or in a skilled nursing facility. They could have every disease known to man, and we'll still take them as long as they're not in either of those two situations.
Amazing.
If someone does have a pre-existing condition, let's say they have cancer, they can get our policy, and then after 6 months, they can get home healthcare benefits from it.
I just don't understand how that works.
Yeah.
I don't understand
Six months waiting period on anything that's pre-existing.
from the company standpoint, I just don't see how they can keep this product alive. And how long has this product been around?
Since I've started 11 years ago.
Wow. So obviously it pencils, right? If it was a money loser, right, they wouldn't do it. So the pre-existing conditions isn't negatively impacting the company enough where they can't afford the service. I think all of us, just from a human standpoint, want to be at home when the golden goose is shot, right? We want to be in our bed. We don't
Right.
comfort our own bathroom, comfort our own stuff, right? I mean, none of us, we don't even like to go on vacation and stay at somebody else's place, right? We're awkward. We're fish out of water, right?
Right.
So all of a sudden, when you're in an injured position or healing position, I mean, who wouldn't want to be at home? I have been impressed. I'm not going to get into the schedule of benefits, but I can tell you from what I saw on the schedule of benefits, the payouts per day were pretty damn substantial, right? From an actual what RN. Can you elaborate on the various levels of care?
RN, respiration, therapy, physical therapy. We pay for home health care aides. They have
I think I saw adult daycare.
adult daycare as part of that. It even incorporates hospice down the road should that ever come into play. So it covers a pretty broad brush, you know, of different benefits.
Let's talk about the hospice situation because I'm really confused about it. I've kind of like most people, I'd say, buried my head in the sand about end of life scenarios and really chronic disease type stuff. So I really don't understand that path. I've had some grandparents have been in a hospice situation. I've never really understood how I assume the government just has like a hospice pay. They pay for hospice services because I don't remember my family. Um, Paying for hospice. I wasn't really privy to I was pretty young, so I wasn't privy to my grandparents' financials. I never thought of them as being destitute and needing I never knew them to be needing government, you know, care, government welfare, but then all of a sudden hospice seemed like it kind of is that something that everybody has access to some dollars from the government when they get into hospice? Do you know about that much?
Well, if they're on a major medical and they're under 65, then they're going to have it as part of their regular health insurance,
It's just part of Medicare.
and also Medicare. Yeah.
So I didn't realize major medical being that's kind of terrible. Me being a health insurance agent, I didn't realize that part of the major medical plan included hospice.
Yeah.
I didn't know that. So it's just subject to deductible co-insurance, and all of a sudden you have hospice care.
Yeah.
Huh? So they won't do the in-home health care, but once you're diagnosed in a hospice situation, then your health insurance kicks in to cover that.
As far as I know.
Ooh, I'm gonna look into that one. I haven't heard
Yeah.
that. So let's just go back into the Medicares because most people typically are in a hospice situation when they're older. Um, so for those people who are in hospice, there's plenty of people who can't afford it. Let's just say they have your plan, and then the hospice, whatever hospice coverage is there through the government or however that works, which I'm gonna actually not talk about. I'm gonna get a hospice specialist in here to help explain
Sure.
what is hospice,
Yeah.
right? How does that work? Um, And then, so if they let's just say that I do get that specialist in here, if they were here at the table, which that's a conversation that I look forward to having. Hopefully you're willing to be part of that. How would this policy that you're referring to, does it negate any of the benefits that they have? Does it just pay separately outside?
Exactly.
And it's just going to pay, so it's not going to pay to the hospice community. It's going to pay directly to the person who's
Yeah.
the patient themselves.
Yes.
Interesting.
So it's an indemnity product, the home health care is. So we pay fixed amounts for various services that are part of that policy. And under hospice, we pay $200 a day. So if someone's on Medicare, their Medicare is going to pay for the hospice, and then we pay the client on $200 a day for every day they're in it.
And they're just throwing that in the bank to cover funeral expenses or whatever they choose.
Right.
Right.
Yeah, wherever they want to use it.
And the fact that you guys take on the pre-existing condition, that's I just, again, I don't see how this I don't see how this policy stays in force.
Yeah, and there's ways of paying your premium on this policy too. I mean, we pay, um, for prescriptions, 24 prescriptions a year at, $25, that's $600. We pay $100 every year for someone to have a physical, $100 for 2 dental visits in a year, $40 for an eye exam, $75 towards glasses. So, the way I work it up, anybody who's under 75, they're basically getting, if they use all those benefits, extra benefits that are part of it, they're paying $100 a year for home health care, 180,000 or 500 a day times 360 days.
That's amazing. $100 a year after they just doing things that they ordinarily already do.
Yeah,
Most
they
people are
could
on
be. Yeah,
most people are on 2 medications
a
anymore,
month, yeah.
especially because you said that's up to 65, that price point?
That's up to 75.
Up to 75. So if you're under 75, this policy is likely gonna cost you it's gonna net cost you $100 a year.
Right,
Wow, for things that you're already doing, you're taking advantage of.
right.
And so if I were to be 76,
Then it works out to be about $48 a month,
yeah,
at that point. Yeah,
so $600 a year,
right.
roughly.
To avoid having to go into an assisted living facility. So when I, ask my clients, is it worth it? $50 a month to stay out of assisted living should you need, nursing? The answer is always yes.
Oh, yeah. Who wants to go again, that environment, we've all seen it, and it's just
Everybody wants to stay in their own home
oh, yeah,
when they're sick.
right. Okay. Well, this is, again, the product when I was introduced to it, which I couldn't believe that you took on pre-existing conditions. And the fact that you have a home health care benefit wrapped around with this indemnity coupled up with I mean, it's all indemnity,
Right,
meaning that you have to incur the cost and then you get reimbursed,
right.
right? Or incur the situation and you get reimbursed. Um, the fact that you guys have built in the health component when you're not in a home health, home health need, the fact that you are doing these for people who are on medications, or go get your physical, get your eye exam, get your dental cleanings. Those are things that people do.
Yeah, they should.
They're like well, they should, and a lot of people typically are.
Mhm.
Um, I've just never seen anything like it. So those 2 factors right there alone, I think really probably separate you guys in the market. Is there anybody
Yeah, I can't think of anybody else that offers home health care like we do. I've seen a lot of different policies, but none of them are even close to what we do.
yeah, and you've sent me the thing on the fine print and I'm getting with some other hospice people. Ever since I met you, Jim, you've been kind of been like going through my brain like, wow, this is just too good to be true. How do I get the message out there? Because I think most people are going to be like me, like this just sounds too good to be true, right? It's just this can't be accurate, right? Where's the it's almost I don't want to say snake oil, but it just kind of seems too good to be true, right?
It's real.
It's real. All right. So, I think and there's a lot of things we could talk about with this, but it's pretty straightforward. If you want to avoid the nursing home, from a recovery standpoint, uh, you need a policy like this, or you better have deep pockets, be willing to spend that hard-earned money on things you don't want to spend it on.
Right,
But for $100 a year net cost, you can avoid tipping into your own pockets,
right.
and you can pay your sister to help take care of you, or your son, or your cousin, or your neighbor.
Well, it's gotta be a professional licensed person to do it, so you can't
You
can't
can't do
use
it.
relatives, but yeah.
When does the adult daycare kick in?
When it's needed, when a doctor says that someone needs to go into adult daycare.
Adult daycare. So what's the difference in that adult daycare? That has to be a licensed professional?
A facility, yeah, so it's the way
Oh,
yeah, so they can go to a facility and for the day,
okay.
and then they come home.
Oh, okay. So you do have to in order. So the payment, the reimbursement benefit is only going to be for licensed individuals,
Yes.
not for the neighbor or somebody else.
Right.
I see. Okay. I'm glad we clarified that. I'm sure as time goes on, I'll have more questions, but in a nutshell, if people want more information, they need to reach out and we can get into the nitty gritty on this policy. Thank you for coming in today and keep it nice and short and sweet. Nobody wants to talk about this dismal stuff,
Yeah, right.
but when it's important, right? Failing to plan is planning to fail, right?
Yeah, that's why we get insurance.
That's right.
We hate
That's right.
getting it, but we love it when we need it.
You totally.
Yeah.
Jim, thanks for, again,
Thanks for having
spending
me.
time to come down. I really appreciate it.